What is the connection between fertility treatments and multiple pregnancy? A multiple pregnancy is a pregnancy in which you are carrying two or more babies at the same time. If it's two babies, it's referred to as twins. If it's three babies, it's referred to as triplets. It's possible but rare to carry more than three babies at the same time. There are two ways in which you can have a multiple pregnancy. The first is when a single fertilized egg splits into two right before it implants in the uterus. The second is when more than one eggs are fertilized by different sperm at the same time. Depending on how the multiple pregnancy occurred, siblings can either be identical or fraternal. Women undergoing fertility treatments have a greater chance of being pregnant with multiples. So why does this happen? The goal of fertility treatments is to have a single healthy pregnancy. But certain fertility medications and procedures which are done with the goal of improving the chance for conception, such as ovulation induction, ovarian stimulation, or in vitro fertilization, also increase the chance of multiple pregnancy. About 25 to 30% of births post-fertility treatments can be twins or multiples. In ovulation induction, women take medication to stimulate the maturation and release of eggs in cases where there is irregular ovulation or anovulation, that is an absence of ovulation. In ovarian stimulation, medications are taken to stimulate the release of multiple eggs from the ovaries in the hope that at least one of them will get fertilized by a viable sperm. These treatments are then combined with timed sexual intercourse or intrauterine insemination. Since these procedures result in the release of multiple eggs, there is a greater chance that more than one eggs will be fertilized at the same time. And if all of these fertilized eggs successfully implant in the uterus, then it results in a multiple pregnancy. In vitro fertilization or IVF, fertilization takes place outside the body in a lab. For this, mature eggs are combined with a large number of healthy sperm that have been washed and concentrated. These optimal fertilization conditions result in the formation of more than one embryos. When transferring back to the uterus, more than one embryos may be transferred depending on the age of the patient and the quality of the embryos, with the hope that at least one of the embryos will successfully implant. But when two or even three embryos successfully implant, it results in a multiple pregnancy. While having twins or triplets can be exciting, it does put babies at an increased risk for preterm labor, for low birth weight, and for having certain birth defects. In addition, women carrying multiples are at a greater risk for developing high blood pressure, diabetes, and anemia during pregnancy. There are some steps that can be taken in order to minimize risk, such as canceling a treatment cycle if on monitoring it looks like too many eggs are developing at the same time, limiting the number of eggs that are transferred back to the uterus after IVF, and undergoing a procedure known as selective reduction if multiple embryos implant successfully.